Now I'd like to turn to some more hopeful news, and that is vaccinations. As you have probably heard, two companies, Pfizer and Moderna, are preparing to roll out their COVID vaccines, and other vaccines are expected in the future. Pfizer and Moderna say that their COVID vaccines are 95% effective in large-scale tests with thousands of volunteers. Both Pfizer and Moderna have applied for emergency use authorization from the Food and Drug Administration. I want to outline for Virginians what to expect in the coming weeks and months. First of all, we have every reason to believe that these vaccinations are safe. Remember that this is a global pandemic, and the best science available worldwide has gone into developing and researching these vaccines. Thousands of scientists, governments, and research labs have worked around the clock all year to bring these vaccines into reality. I've seen this level of cooperation and coordination just once before when I served during Operation Desert Storm. The Virginia Department of Health's vaccination team also has a work group doing an independent review of the vaccine data. So this will back up what we're seeing at the national level. Vaccine science is nothing new. Vaccines have been around since the first smallpox vaccination, which was invented in 1796. Vaccines have reduced or eliminated many deadly diseases, saving millions of lives. Vaccines do not give you COVID-19. Instead, they spur your body to produce antibodies to the disease. As a matter of fact, this vaccine does not use a live or attenuated virus. You will not get COVID from this vaccine. Scientists know how to create vaccines that work and, most importantly, that are safe. As a doctor, I am confident that all protocols have been followed and no corners have been cut, and I expect the FDA review will show that, just as results have already shown in the UK. Second, we fully expect to have enough vaccine to get to everybody, but it will take time, so we all need to be patient. The Federal Centers for Disease Control and Prevention have worked for months to identify groups that need to receive the vaccine early on, and last night the Advisory Committee on Immunization Practices voted to put healthcare workers and residents of long-term care facilities first in line, and this makes sense. Healthcare workers take care of the rest of us, and nursing home residents are some of our most vulnerable people. It's like when you get on an airplane and they tell you that if something goes wrong, to put on your own mask first so that you can safely help other people. This is the right thing to do, and Virginia will follow the CDC's priorities. Virginia is planning a phased approach which aligns with CDC guidelines. As we get more vaccine, we will be able to prioritize other groups, such as medically vulnerable people. If we don't initially have enough vaccine doses for the entire priority group, we have plans in place for determining who goes first, based on medical ethics and protocols created by the Virginia Hospital and Health Association and our Virginia Disaster Medical Advisory Committee. We're setting our priority groups because we expect that most people will want to get vaccinated, and there will be a lot of demand. That is how we eradicate this virus and how we get back to normal, and that is if everyone gets vaccinated. The Virginia Department of Health has been planning for this vaccine for several months, starting in the summer. They've worked with hospitals, long-term care facilities, and providers in the community, and have the systems ready to keep track of this large-scale operation. VDH's vaccination planning has also included members of our Health Equity Working Group to ensure that vaccination distribution is equitable and that it is fair. It's important to remember that VDH, or Virginia Department of Health, has decades of experience with vaccination programs and public health emergency preparedness. They know how to vaccinate people safely and efficiently. VDH has worked to develop a detailed distribution plan that ensures we get vaccines to every part of the Commonwealth and every population fairly and equitably. So here's what we expect to happen next. Assuming the FDA grants Pfizer emergency use request, vaccine doses will ship to the states immediately. This could happen as early as mid-December, just a couple weeks from now. Virginia expects to get about 70,000 doses from Pfizer in the first wave, enough to give 70,000 individuals to get their first dose of the vaccine. This will happen at hospital systems or facilities equipped with ultra-cold storage facilities which exist in each region of our Commonwealth. Virginia has also partnered with pharmacy chains CVS and Walgreens, as well as other pharmacies and medical offices for vaccine distribution. Both Pfizer and Moderna vaccines require 2 doses, spaced about 3 weeks apart. Pfizer will ship the second doses in time for those 70,000 people to receive them. While this happens, Moderna and likely other vaccine makers will be going through the same FDA process. So we'll start seeing more vaccine doses being allocated to Virginia. The companies are manufacturing these doses now as we speak, even before final approval, so that distribution can move quickly once that approval comes. When our turn comes, my family and I will have no hesitancy about getting vaccinated, and I strongly encourage every Virginian to get the vaccine. That is our only path to getting back to that near normal which we often speak about. Now it will take several months to get people vaccinated. For now and for some months to come, we all need to continue doing the things that we know work: wearing a mask in public, washing our hands, staying away from crowds and large groups, and trying as best we can to socialize outside. I can't stress enough how important it is to be careful and to take precautions. You aren't just making an individual decision for yourself. Your decisions impact a lot of other people. And when we have 100 people or 1,000 people thinking they're different from everyone else and don't have to follow the guidelines, that's how we get to these increased case numbers. What we all do affects other people. Especially now, with these vaccines just around the corner, so that we can start to think about an end to this pandemic, it is foolish to take risks. Be more careful than you think you need to be, especially with the holidays coming up. We can get there, but all we have to keep being smart, we have to keep being safe.